on average, 20 to 30 people a day ask to try to, can they get into treatment, and there are only 2 or 3 slots available to them. Part of such programs should be to encourage the wider treatment. Various studies have shown, the most recent I know of by the Rand Corporation, that every dollar spent for treatment saves $7 in incarceration and other kinds of costs that the public pays. By the way, the Baltimore Needle Exchange program is so well accepted that when it snows, the television announcers that tell what schools are going to be closed and what offices are going to be closed announce that the needle exchange van won't be operating today, or it won't be operating in these areas. It is a perfectly accepted program in the city. Various surgeons general and other directors of health and human services have endorsed needle exchange. I like to point out that Dr. C. Everett Koop, who played a central role in rallying evangelical Christians to oppose abortion before Ronald Reagan appointed him Surgeon General, applied his pro-life convictions to this issue as well. He said, when we are dealing with something as devastating as the AIDS epidemic, it doesn't matter what we do to reach people that have to be reached. We have to do it. If clean needles will do anything to contain a part of the epidemic, we should not have any foolish inhibitions about doing so. And in the larger article that I've given you there from the Baker Institute paper, there are other quotes from other key leaders. I think it's interesting to look at the comparison between Australia and Texas. The populations are approximately similar. There are 20 million Australians, 23 million Texans, and the number of injecting drug users are almost identical, about 100,000. But they differ dramatically in the number of people living with HIV/AIDS. 56,000 in Texas to only 14,000 in Australia. After a decade of these programs, Australia did a study and estimated that they had saved as much as $4.1 billion through their programs. This is the most dramatic statistic to me, though. For every 14.7 new AIDS cases for every 100,000 Americans, there is 1.1 new AIDS case in Australia. It is a dramatic, and Dr. Alex Wodak, who's with St. Vincent's Hospital and has spoken at a conference I organized at the Baker Institute, one of the real world pioneers on this, and he's baffled by our reticence to adopt this widely. Also, that cities with on a study of 103 cities worldwide, cities without NEPs experienced an average annual decrease in HIV cases of 18.6%. 18.6% decrease. Cities without such programs had an average 8.1% increase. These programs can be successfully funded. There are, as you have found here in Bexar County, there are foundations that are quite willing to provide money for them if they are seen as legal. I think we have a good chance this time. It's worth noting that I testified in the 2005 legislature in behalf of these bills and before the Senate committee, and the chairman of that committee, Senator of the Public Health Committee, Senator Jane Nelson, said, I can't disagree with the facts, but what would I tell my daughter if a needle exchange program opened in my neighborhood? And I understand that concern, even though there wouldn't likely be such programs opening in her neighborhood. And as Elaine was pointing out this afternoon, the programs come to where the people are. So that the use of needles for injecting drugs is not going to be a surprise in the neighborhoods where these exist, in most cases. But in 2007, without saying anything during the hearing, Senator Nelson voted aye in favor of the bill, and the vote was 7-1. In the House, the counterpart committee, the vote would have been 6-3 or 7-2, but the chair refused to bring it to a vote. And that was a factor in and it was toward the end of the session, so it died. That was a factor in the legislature's letting Representative Jones McClendon add on her paragraph that got at least for Bexar County to have a pilot program. I think we clearly have the votes for this in the Texas legislature, and I'm very optimistic about its passing this time. There will be, of course, opposition to it. Since the science is clear, since there's really no doubt and no experience that counters any doubt that people have on the basis of science, the major argument against it continues to be it sends the wrong message. I've written here, before we accept that rationale, we need to think about the message we currently send. We know a way to dramatically cut your chances of contracting a deadly disease and then spreading it to others, including your unborn children. It would also dramatically cut the amount of money society is going to have to spend on you and those you infect. But because we believe what you are doing is illegal, immoral, and sinful, we're not going to do what we know works. You are social lepers, and as upright, moral, sincerely religious people, we prefer that you and others in your social orbit die. Is that the message we want to send? Senator Bob Deuel, who is one of the sponsors of the bill in the Senate, talked to me, and this is from my article in the 2007 issue of Texas Monthly. Said, there's also the compassion factor. These are human beings. I don't want people to get these diseases. Some people say, punish them. Let them suffer. Let them die. I look at it from a Christian viewpoint. What would Jesus do? We need to show compassion and try to help. They are God's children too. When they need new needles, this puts them in touch with someone who might reach them. The very act of handing them clean needles says, your life has value to me. I want you to know that we care about you. When you want to get off of drugs, we're here to help you. If they're in a back alley using a dirty needle, there's no chance of that. Do I wish we didn't have to do things like that? Absolutely. I'm a conservative Republican. I don't like drug use, but reality is reality. Some people are going to use drugs. Then he talks about how much it's costing the state, and says this saves human suffering. It saves the state money. This is not just win-win, it's win-win-win-win-win-win-win. I hope we can pass it with education, facts, and reason, and not kill it with emotion. I really applaud that statement by Senator Deuel. Let me just close by what I've said at the end of several things here. No responsible person wants to encourage drug abuse. No fiscally prudent person wants to waste money simply to satisfy a sense of self-righteousness. No compassionate person wants to consign people unnecessarily to death or a living hell. Fortunately, providing injecting drug users with access to sterile syringes allows us to be responsible, prudent, and compassionate. And those are good criteria for public policy.